And I have told you that there are top 3 drivers for that.
Okay.
Those top 3 people undermine them. Some people don't know them.
Yes.
But as I've told you, these fibroids, we can make them to shrink without even removing them with the surgery.
Okay.
There are ways. In fact, I've moved to already 52 countries in the world doing research. I've liked the research in Germany, in Russia, and also Brazil. The cause, one of them is in the body, is estrogen overload.
Okay.
Estrogen is a hormone for women. If it is not balanced, it is going to be a fertilizer for fibroids.
Okay.
So first of all, if we see that you have excess estrogen, we get a way of balancing it.
Okay.
And also, the fat cells makes estrogen. One of the things I've said that women must not put on more fat.
Okay, so that's an issue we have with many Ugandan women.
Yes, if you are fat, we help you to remove the extra fat.
Okay.
Because it enjoys staying in fat.
And that's how it develops.
Exactly. The other periods, that is when estrogen fertilizer for fibroids, you'll find that other periods, no kids, birth control pills, and more exposure.
Yeah, sure.
And also the state diet, people stay in the diet encourages the fibroids.
Okay.
The chicken with hormones.
Yeah.
Cooking oil also is one of those.
Okay, the factors that...
and the plastics. I've seen women drinking water in plastics.
Yeah.
Plastics also, in 1970 we never used a lot of plastics. Another cause which is vitamin D deficiency.
Okay.
If the vitamin C is not enough in your body,
yes, it causes.
Yes, the vitamin D tells fibroids stop growing. Okay. And 80% Ugandans, black, have a lot of lacking vitamin D.
Okay, yeah, sure.
They are lacking vitamin D because they are doing office jobs and no meet the sun. When you have sun,
okay, so they sit in their offices full time.
Yes,
they lack
the sun is one of those things which help them.
Yeah, sure.
Exposed to the sun, you sit there and you enjoy for at least 30 to 40 minutes a day. Okay. But they are not doing it. I've talked about what happens. I've talked to estrogen overload. Overload, yes. Now I've given you vitamin D deficiency. So if those two have a problem, also you will have a problem with the fibroids.
Yeah, sure.
Now, chronic inflammation.
What is exactly?
That one, these are problems caused by modern eating.
Okay.
Modern eating. Women like a lot of processed foods.
Okay.
Sugars will encourage them to come.
Yeah.
I've seen women, funny enough, my wife is a doctor, always I fight with her when she's taking 6 spoons of sugar in a small cup. Until I have educated her now, she has come to 2.
She has reduced to 2, but 6 is a lot, by the way.
No, a lot of women are taking, they like sugar.
Yeah.
They like cakes, chocolates, those are the things from the age of 4. They are interested in foods which bring inflammation in their body. Yeah. And you'll find that as you take the sugar, you are making fire.
Inside the body.
Yes, and fibroids grow also like a soda. When you are taking a lot of soda,
they will develop.
They will develop. What else? You'll find that the family history.
Okay.
Genetic information. If you had this in your family,
Yes.
also they will be there. I've talked about taking alcohol and also red meat 7 days. When we are taking meat, we should always take it at least twice.
Okay, not daily.
Yes.
Okay. So, doctor, we have seen that most of the cases are being diagnosed today for fibroids. Why do you think they are being diagnosed more today than before?
This is what I have talked to you, that my grandmother, it's good I was with her. In fact, even around independence, she was highly honored. It is, I have told you that in the past, they never used it to fly so much.
Yeah.
And another thing which encourages them, which I'll talk about,
Yes,
is a lot of women have heavy metals in the body.
what do you mean by the heavy metals?
Heavy metals, mostly it is lead, is a heavy metal.
Okay.
It comes from what we eat, from what we drink, and the environment.
Okay.
You'll find that women around the lakes, they are getting a lot of fibroids, Lake Victoria.
Okay.
And also, heavy metals, lead is number one. Another thing is mercury. Mercury also, I've seen almost 60% of the people on my computer, they have heavy metals and they don't know.
Yeah,
they get mercury from when they are processing the gold in Busia, in Kasanda. It goes to the rivers, and this mercury which is processing, it goes to the small fish eaten by the yes.
That and they like it a lot.
Exactly.
Yeah.
So when what a campaign want to do is to examine these women at an early age, remove the heavy metals, balance the estrogen. You get me?
Yes, sir.
So it is very easy if you know what is causing this, and you work on it. You find I've taken this model from Germany and South Africa.
Okay.
The women go for examination to see whether they have heavy metals, if the estrogen is balancing, if they are taking food which has no sweeteners. When you are at that age below 50, you have to be very careful. Very careful. Even if you remove the fibroids, some people go up to spend money going to Germany and India.
Yes.
If you don't remove what is the cause, you are wasting your money.
Time and
the same like
after.
You come and you get them again.
Yes.
Yes.
So, doctor, we have looked at the causes. You've broken them down for us.
Yes.
What are some of the common symptoms or the symptoms women should look for?
One of the common symptoms, you look at the stomach is not normal. It becomes bigger.
Okay. But most of the women have, right now in our country, they have like big stomachs. So how does it mean like most of them should go and check in?
Yes, when they're at the age of 50. I have an example. I give you 1 minute. My wife invited her sister, a bigger sister. She came to our place, incidentally with a 5-month pregnancy. And we told her to go for examination.
Yeah.
That is in South Africa. Okay. She came back and they told us her that she has twins.
Okay.
But we wanted to see again. Are they really twins?
Oh, there is something more.
More.
Yes.
When we went for more examination, we saw that she had a developing child inside the stomach.
Yeah.
And also had a fibroid. They are next to each other.
That's a complicated case.
So the only thing we have, medication is in the form of nutrients we started giving her.
Okay.
At the age of 5, we never wanted her to go for, and it is the only child she was expecting because she was already 46.
Yeah. Okay.
So women suffer. She used to sit in our sitting room every day, no sleeping, but we are giving her supplements and medications which can help the child to stay until the age of, until the month, 9th month. So when she reached with that final stage, I drove her to the hospital. They gave they removed the baby and also the fibroid, but she's okay. The child is 16 years and is going to school. So I have seen this from my grandmother when she's doing it, and I've seen women also when they are suffering from fibroids. We look at we test them. At times we look at we examine them properly to see, we send them to hospitals.
Doctor, on that very note, can a woman get fibroids without having any symptoms?
At an early age of the fibroid, the symptoms will be impossible to see. That's why they have to go for a checkup. When she goes for checkup, they are able to see that no, this is something coming, a fibroid. And also, when women, I've told you, estrogen. If you have extra estrogen, we conclude that you are more likely to get a fibroid. Why do you have extra estrogen? This is a symptom that you are more likely to have a fibroid. The big stomach, and also the way how you are eating. Women with fibroids or developing fibroids, I've told you, they tend to like a lot of sweet things, very sweet cakes and so on.
So, doctor, which women are mostly at risk of getting the fibroids?
The what?
Which, like, if you are to break down according to the age groups, which women are most likely to get the fibroids?
I can say that women who are really expecting, women, other symptoms, your menstrual periods, we need to see, are they longer? Between the next menstrual cycle or period, do you have bleeding? If women, is it extra bleeding or is it light? So if you have between the periods that blood is coming, it is one of the ways which shows that this woman might have a fibroid. And also when when you got menstruation, and a lot of blood come, also is another sign. Yes, extra, not light. So that is when we start helping them, that if you have this problem between periods,
you can go and check in.
You can go and check, or we can stop it. But we have a lot of methods which can help you. And also women with infection.
Who normally get infection.
Yes. We need to make sure that we do help them. So all with those findings, we have been able to see that we can help them at an early age. I've talked about the thing of heavy metals and the estrogen. That is very serious. So women should come for examination to see whether you have heavy metal. I have a way of removing it. I have done that very well, that study in Russia and Ukraine. Our university here, they are not teaching much about removing heavy metals, and they don't talk about them. But today, they are very common.
Very common.
Lead and mercury, arsenic, including copper. You find it in your body, and when it is there, it is encouraging fibroids to grow. Yes. Now, we shall need, because of time, to see how could we help them. So also there is a question that normally comes up with people: how do these fibroids affect the fertility of women, or it's just a misconception? I've talked about the lady who was the sister to my wife. When they come multiple they will try to take the space.
Okay.
If it is one, it can grow with the baby, and at the last minute, you make a cesarean. You remove it. Okay. And when the child is growing, you must make sure that there is no bleeding at all. We have those ingredients or medications we give so that the woman doesn't bleed or bleed at all. Okay. Or when you are still young, we help you so that if you have heavy bleeding, you stop it. Okay. Yes, bleeding is one of the very difficult parts for women. Yeah. You have to examine whether it is heavy bleeding, whether you are bleeding between the days for starting and stop. Exactly. Okay. Whether when you are bleeding, you have extra bleeding.
Okay. So, doctor, you talked about treating the fibroids without removing them. When is it necessary to do surgery? Or we can treat
when it is below 10 centimeters, you know? Yes. The fibroid, we can use this method of giving you extra medications and these nutrients, supplements. Okay. But if it reaches 10 centimeters, go for examination, see a doctor, and get experts. Okay. So that you don't just go and somebody gives you funny things. It says he's removing a fibroid when you are going to we call it an accident.
So we have seen like most cases of women dying after they are being operated with fibroids. What's your take on that? Like our MP for Kalahangala, who has just died of recent. What's your take on people dying after they get surgery for fibroids?
That's why I say we need proper examination. Go to experts. We have a lot of experts here at Mulago.
Yeah, sure.
Others, and they also continue checking. Because you might, as I saw, she might have had multiple fibroids. And I don't know whether she had a child before.
One child.
One child. Yeah. Yeah. That's what I've said. She might have removed them. I might have removed them in the past and succeeded. But with the change of estrogen, with the presence of her metals, they will come back. Okay. That is why you must remove the cause.
Before you do the
Yes, before you waste a lot of money. Okay. Remove the cause. What is bringing them? What is making them to grow? What is feeding them? I've told you that estrogen can be well balanced, and estrogen feeds them very well. Okay. But now we have methods of vitamin D3.
Yes, the prevention part of it. Let's just go straight to that.
Yes. It turns off fibroid growth. You get me?
Yes, sir.
Because it will help 30%, and it is cheaper.
Okay.
I think it is about the price is about is it 20,000 Uganda currency to do that. Okay. If you sit in time. Another one, we have a number of things we give. I've seen German, South Africa also gives women what we call green tea.
Green tea, okay.
Yes, it helps. Green tea is very good. And you do it 2 times a week on empty stomach. It blocks estrogen. Okay. Not only that, also Albizia species, which we have in Uganda, okay, also blocks anything blood going through to feed the fibroid. Okay. And it suffers and shrinks. Another one is Erycina, Erycina species, which is very common also in Uganda. I've been going to market, I see women have it. But you don't give only that, you give in a form of a combination. Okay. And use it like, you can use it like a tea. You get me?
Yes, sir.
Yes, and we have also an injection.
That is given out. An injection that can be given out.
Yeah, it's given to the women, and also they are using it in Germany, and I'm sure they have it also in Uganda. It is called GnRH injection.
Yes.
It has Radix, and it's used within 3 months' time.
Okay, so when you use it in 3 months, the fibroids can go?
Yes, but it's given by doctors only.
Okay.
Yes, you get me?
Yes, sure.
And it will work on the level of estrogen, and it will make the fibroid to starve.
Okay, if it starves, it dies?
It dies.
Okay.
Because it is not getting, the tube is not getting blood to go to it. So it shrinks and dies.
Okay.
Diet, anti-estrogen. You must have a diet which does not feed fibroid. I've said cut sugar, milk, if you know that you are very fat, chicken skin, add dodo, broccoli, pumpkin seeds, because pumpkin seeds have a lot of vitamin C.
Okay.
That is very important. If you can get vitamin C, get mukene, those lower estrogen. And at the same time, they lower inflammation.
Okay.
So it drops, it will drop by 30%. It stops new ones to appear.
Okay.
Weight loss is one of them. Control your weight. Fat is the factory of estrogen.
Yeah.
Less fat, less fuel.
Less fuel.
Stops growth free. Uganda combo that works. Vitamin D, I've told you.
Yes, sure. That's
Dodo, cabbage, daily. Walk 30 minutes per day.
Yes.
Lose weight, 5 kilograms at least per month. Period time, you must have light periods.
Okay, not heavy.
And baroque symptoms down. Periods lighter.
Okay.
You have to see, when you are going to periods, is your blood light?
Light also.
Yeah, you must also try to go to the doctor and see if there is any complication.
Okay. Thank you very much, Doctor. As we are winding up, please give us your last take on fibroids. What would you like to tell the people on fibroids as your last take on it?
They should have a positive thinking. If there is anything, they must visit doctors. They must eat the right food, as I've told you.
Okay.
They must not say that if you have HIV, you have infections, they cause fibroids. No.
Okay.
I've told you what causes
it?
Fibroids.
Yes, sure.
So I don't stay here, but I usually come to Uganda. I want to make a way of meeting enough women so that they must have groups to go to schools,
okay,
to go to the universities, so that they can educate the people. I've seen this happening in South Africa.
Okay,
I've seen this happening in Germany, because this model I'm giving you is coming from, in fact, I used to study in West Germany.
Okay.
And also I used to study I studied in Russia and Ukraine. I was going deeper to see how women are behaving. Particularly, I was looking at the sportsmen, because I'm a specialist helping sports women.
Okay.
Sports women, how they could go on to bring medals. I've been going to Kapchora. Whenever they are preparing for Olympics, I talk to them, I see them, I do examine them, so that they cannot be disturbed during the time when we want them to bring medals for Uganda.
Okay. Okay, so Doctor, thank you very much for that take.
Yes.
And to our viewers, thank you for being with us, and thank you for tuning in. And before we close, please send greetings to 1 or 2 people. We can call it a day.
Greetings.
Yes.
I want to talk to send to Dr. Mayanja. He's not here, but he's the one who brought me here to driving me. You have a lot of another thing. People must avoid a lot of congestion and pollution. Pollution. When you reach, if you are a lady, you expect that pollution. Particularly if you are in the middle of the city.
Okay.
Pollution is put on a mask, not during only when you are expecting COVID, but also pollution. I send my greetings to Dr. Nambatia. I send my greetings to my sister Loiza, where she's, and incidentally, my wife. I think she's also getting this. She's in South Africa.
Okay.
Yes, and I have another daughter also. She's a doctor in Cape Town. I thank them for supporting me and bringing me here to Uganda. I send also a message to people. Dr. Okeyo. Okay. I like him. When I had a problem, he took me for surgery 3 years back, operated me in Uganda, and with Dr. Rusiva. I was so grateful. I went back to South Africa when I was still alive, and I'm alive until today because of his surgery.
Okay, thank you very much, Doctor. And our dear viewers, we are seeing that fibroids are very common, but awareness and early detection and proper care make a difference. And understanding your body is the first step to treating the fibroids and a step forward for protecting your health and the future. So thank you for staying with us. This has been your health show. But before we go, Doctor, yes, where can someone find you, and when are you coming back to Uganda so that we can have more discussion about
I'll be coming to Uganda after 1 month. If people want, I have a clinic here at Najanankumbi. When I come, I go there, and I'm intending to leave at the end of this week. Okay. But after 1 month, I'll be back. I'll need to help more. I was supposed today to talk about ulcers. More than 60% around Kampala
suffering from that.
Yeah, I wanted to tell them why.
Okay.
And you can remove it within a week.
Yeah.
I've studied, I've gone to people and I've examined people on a scan, okay, why they get ulcer. And they waste a lot of money taking medications. People are busy, others taking Waraji on empty stomachs, others the type of food they eat, and also others the type of also heavy metals.
Also, it comes with it.
It comes also with the heavy metals. Okay. I've helped women with tumors in the breasts. No. I look at heavy metals. Heavy metals is a big topic today in Uganda. People have to start tackling it. And they have to tackle the hormones. Okay. They have to tackle the way how people can stay in the city, because we need the city. We have to stay in the city. How can they remove pollution? Okay. Yeah, you take an orange a day in the morning. That is vitamin C. Okay. It will remove when you have ulcers and other things. It will clean, and also the type of food you are eating, the way how you are staying. People are not sleeping enough hours. A person is supposed to sleep 8 hours a day. I've been going around Kampala. Some people sleep only 2 hours, and they come to the office.
Of course, there is a lot of workload.
Yes.
Okay, thank you very much, Doctor. We are so glad to have you today, and we look forward to having you more to talk about more of the information you have shared with us. And to our dear viewers, thank you for being with us since we started this show up to now. We are ending it. As I told you, we'll be here every Monday to Friday, so we shall meet tomorrow, same time, same hour. Don't change to any other station, because TV1, of course, we do make a difference. We show the difference. That's why our tagline is "See the difference." So don't change to any other station. Let's stay here, because we are bringing you more and more good information. Let's meet tomorrow. May God keep you safe.
Did you give them my phone number, or
okay.
they need it?
No, of course. As we are ending, let's get that phone number from you.
My number is 078 74 55 333. 078 74 55 333. That number is a roaming number.
Okay.
Even if you call it without a code, it will reach me where I am, okay. Any country.
In any country you...
Yes, I will get it.
Okay.
Yeah.
So our dear viewers, that has been Dr. Josiah. Let's meet tomorrow. May God keep you safe.